Here are 3 tests to diagnose if you have sciatica or not and how to fix it. Test 1, the further forward you bend, the more tension and pain you feel in the leg. Test 2, hip external rotation. If you notice it's really tight and painful to cross the one leg but not the other, that's a sign of nerve tension. Third test, in a seated position, bend forward, chin down to your chest, straight leg, foot towards the ceiling. If you feel this is very sensitive through the leg, increasing that pain, this is definitely sciatica. Now, how do we fix it? First, our bear position, hands under the shoulders, knees under the hips. Keep the spine neutral as you brace the core and raise the knees up and down off the ground. This will help improve your core stability and calm down the lower back. Now let's mobilize the nerve with a sciatic nerve floss. In a seated position, as you kick the leg, you bring the chin up, and then as you lower the leg and point the foot down, you lower the chin. This is what slides the nerve back and forth to reduce inflammation, increase blood flow, and reduce pain. If you're too sensitive to do this in a seated position, you can simply modify by laying on your back. Last is our lumbar extension. This can help decompress the spine and take pressure off of the nerve. Slowly work into this as you keep the lower back relaxed and the hips on the floor. This will help you reduce your sciatic nerve pain. If you want to learn our full solution, visit the link in bio to fix your back with me.